Hello, my name is Lorena Avitea, and I'm a licensed clinical social worker at the Chadwick Trauma-Informed Systems Project, Dissemination and Implementation, or simply CTIPS, a Category 2 grantee of the NCTSN within Rady Children's Hospital, San Diego. For the last 4 years, CTIPS has been working with 5 child welfare supercommunities across the United States. One of these communities, Volusia County, Florida, has implemented the RPC as to support their trauma-informed efforts. Joining me is Jared Martin, a research associate from the California Evidence-Based Clearinghouse for Child Welfare, commonly referred to as the CEBC, which is also a program of the Chadwick Center. For those not familiar with the CEBC, it provides information and resources on evidence-based practices and how to effectively implement them. In their website, an organization can access detailed information and resources on programs and implementation. So given that both of these projects are housed at the Chadwick Center and that Volusia County wanted to ensure a successful implementation of the RPC, the CEBC shared resources with CTIPS that help Volusia County accomplish this goal. During this podcast, I will interview Jared Martin on how an implementation framework for evidence-based practices can be applied to the implementation of a curriculum such as the RPC. Jared, welcome and thank you for your time.
Thank you for having me.
I'm going to start by asking you, how can the CEBC's work on evidence-based practices inform organizations in their efforts to implement the RPC?
So the mission of the CEBC is to advance the effective implementation of evidence-based practices in child welfare systems and community-based agencies working with children and families that may come into contact with child welfare. So the information that the CEBC uses to provide guidance and resources to organizations on implementation of evidence-based practices could very easily be applied to the implementation and sustainability of the resource parent curriculum. So all the CEBC's training and technical assistance efforts are informed by a research field called implementation science, which is the study of methods to successfully promote research evidence into policy and practice. So the CEBC uses a framework that comes from implementation science called the Epis framework. We use Epis to help guide agencies with making critical decisions around selecting and implementing EBPs, but the Epis framework could be applied to implementing other new types of practices and training curriculum, such as the RPC.
Great, and can you tell us what Epis stands for?
Sure. So the Epis is an acronym which stands for Exploration, Preparation, Implementation, and Sustainment. So each phase includes activities that aid organizations with making sure they adopt a new practice that is a good fit and the practice operates as intended. So I can provide a very brief overview of the Epis phases. So first, the exploration phase is when the organization considers what practice might best solve a clinical or service problem, while also considering their capacity to properly implement the proposed practice. So once a decision is made to adopt a new practice, agencies move into the preparation phase, where they will plan out how they will support the new practice and assess potential challenges. Agencies then move into implementation phase once the new practice is being offered and performance is being monitored. So lastly, the sustainment phase is when the intervention is ingrained in the organization, including stable funding and ongoing monitoring and/or quality assurance processes.
So this is really great information, but why should an agency implementing the RPC utilize the Epis framework? What would be some of the benefits?
That's a good question. So it's not uncommon for an organization to implement a new practice, but it doesn't last long enough to see any meaningful change. So the benefit of using the Epis framework is that the likelihood of successfully sustaining a new practice greatly increases. So there are serious risks to starting up a new practice without carefully and thoughtfully planning it out. Poor or minimal planning can lead to wasted time, money. So the Epis framework can help agencies save important resources. Also, without proper planning, the RPC could be delivered poorly or inappropriately and lead to frustrated staff and poorly trained foster parents, and ultimately fail to achieve its purpose. So using the Epis framework can help you efficiently achieve your desired outcomes.
So when looking at implementing the RPC, can you explain what exploration, preparation, implementation, and you said sustainment would look like? Maybe starting with the exploration phase?
Sure. So if an organization is interested in adopting the RPC, the first step is to make sure it's a good fit for them and their foster parents. The Epis framework recommends that an organization first assemble a small team of individuals, typically comprised of senior level administration, a supervisor, other key staff, and any stakeholders, including a foster parent representative. This team will work together to identify the requirements for operating the RPC and then critically examine their organization's capacity to properly implement the RPC. Some of the critical factors that influence sustainability include long-term funding, fit with the values and operations of the agency, staff education requirements, the matches skill set, and the availability of support for RPC trainers. The team will want to look at what types of supports are available for their staff and how that will influence the sustainability of the RPC.
So there seems like there's a lot of considerations for this phase. Can you think of any other ones?
The organization should also include foster parent and family voice in decision-making processes by allowing parents or youth to voice any concerns or thoughts on the curriculum. Also, the team should reach out to the developer of the RPC or whoever provides technical assistance to ask questions and to determine if the RPC operational requirements are a good fit for them.
Okay, so the exploration phase helps us assess the goodness of fit as related to the needs of the agency and the resources available for implementation. Can you tell us more about the preparation phase?
Yeah, so during the preparation phase, the organization starts by selecting the staff who will be involved in running the RPC, so including those conducting the training. So it's important that an agency make sure they recruit a trainer who is aware of what it is required for running the RPC, including skills like public speaking and group facilitation skills. So an interview process is vital. So once you select the staff training begins and the organization needs to figure out how future staff will get trained in the curriculum in case of staff turnover. But knowing the curriculum isn't enough to run an effective training, so make sure your staff have support with other skills and are provided with access to coaching and other resources. Any serious staffing concerns should be continually monitored and addressed. Also, the preparation phase is when an organization secures the needed equipment and other resources to run the RPC, such as computers, office space materials, and supplies.
And Jared, what are your thoughts about the importance of leadership buy-in during this phase?
So yeah, leadership buy-in is very important, and it's an important piece of the preparation phase. So in both the top of the organization and also in the department, it's important to have leadership aware of the RPC's use, what it's about, the rationale for using it, and the requirements for running it so that they can advocate for its continued use and help secure needed resources whenever issues arrive. One strategy for securing leadership buy-in is to invite those leaders to the sessions where staff are being trained in the curriculum. This can help leaders get a grasp on the curriculum and what it takes to operate it.
So you shared with us the early phases to this framework, and at this point, one should be ready to implement the curriculum. What is next?
So agencies then move into the implementation phase once the curriculum is officially being running and offered to the foster parents. So implementation teams will use training evaluation data to monitor how smooth things are and create solutions to any barriers or unanticipated problems. If there are issues with receiving referrals to the RPC, then implementation teams need to plan for community education and outreach.
And Jared, can you give us an example of what you mean by training evaluation data?
Sure. So every training should be collecting data to help make sure the curriculum is well received and training staff are effectively teaching the curriculum. You want to collect data that your organization can use to help address potential implementation barriers and challenges. So this can include feedback from training participants on trainers' abilities and if participants are actually learning anything from the curriculum. So for example, if a new trainer continually receives poor ratings on group facilitation skills, then that should trigger the implementation team to offer that staff member coaching and resources to improve on those skills. Agencies can also collect fidelity data, which is measuring if the RPC is being delivered as intended. So an option is to have another staff member observe the trainer while he or she is training to make sure he or she is correctly covering the material. So if certain components of the curriculum just aren't effective or going over well with the participants, then implementation teams need to be able to identify and respond by possibly making modifications to the curriculum. But it's also important to note that changes to the curriculum shouldn't be made lightly and should go through a vetting process with the implementation team and possibly the TA provider or the curriculum developer.
Mm-hmm. So it seems like this framework assures that we take a look at sustainability issues, as this is a challenge that we have unfortunately seen before with the implementation of the RPC. An agency is interested and motivated enough to implement a curriculum, but little efforts were placed into thinking about sustainability. Why is this important, and what might this look like?
So as I mentioned earlier, it's not uncommon for a new practice to end before it actually reaches meaningful change. The activities in the previous phases help to lay the foundation for sustaining the RPC. However, sustainment is a continual process that implementation teams play an active role in supporting. The sustainment phase of the Epis framework deals with immediate and long-term issues. For example, staff turnover, supervision issues continue to be monitored and addressed quickly. Also, if there is a major loss in funding, then the RPC needs to have organizational leadership champion for the RPC by advocating through external networks to help bring in necessary resources. Also, outcomes should be examined to determine if the training is actually having the desired effect.
Thank you, Jared, for the valuable information that you've provided us. It has been very helpful. Now, let me share about Volusia County's efforts in implementing the RPC with the use of this framework. Volusia County has successfully integrated the RPC into their communities. The Epis framework provided guidance that helped them develop a plan that was not only sensitive to their needs and resources, but also to the sustainment of this effort. Let me share a little bit about their process. The first step for them was to invite leadership, all potential trainers, as well as community stakeholders to a 3-day train-the-trainer model. This allowed for them to have a full understanding of the content of the RPC and assure that it was a good fit for the community. The material was very well received and positive feedback was provided, allowing them to make the decision to move forward with the implementation. Volusia County then created a team, which included foster parents who were also trainers. They ensured leadership buy-in and looked at resources available within the organization to secure sustainability. And to ensure support, CTISP provided the trainers consultation as needed. Although Volusia County is currently not collecting Fidelity Data, they are collecting data on the facilitators' abilities and on participants' acquired knowledge. They use this data as well as the facilitators' feedback to make any changes necessary to improve the outcome of this curriculum. It's also important to note that the curriculum is implemented in a model where there is a facilitator and there is a foster parent as well as a co-facilitator. Volusia County has now adopted the RPC as a pre-service training for potential foster parents, and because of the positive feedback from facilitators and foster parents, they have begun to use the RPC to train foster parent licensing staff and child care workers that care for children who have experienced trauma. In addition, Volusia County is looking into adopting this curriculum for in-service training for foster parents, as well as kinship caregivers. The goal is that the language and the concepts of the RPC are integrated into the culture of those working with children who have experienced trauma. And a final note is that our experience has been, as we have conversations with other communities, that careful preparation, planning, and execution of a practice is the key for success. Using a framework that provides guidance and implementations such as the Epis can provide more satisfying and successful outcomes. Jared, one last question. Where can one find out more information on the Epis framework?
So they can go to the California Evidence-Based Clearinghouse website, which is CEBC, the number 4, cw.org, and on the website they can access a number of tools and resources on effective implementation.
Thank you again, Jared Martin from the California Evidence-Based Clearinghouse. We truly appreciate your knowledge and time.
Thank you.